This is a summary of the CPIC guideline for methadone and variation in the gene CYP2B6. This guideline was published in July 2024. There is limited evidence regarding the effect of CYP2B6 variation on methadone dose, clinical outcomes, or risk of QTc prolongation. As a result, CPIC does not recommend using CYP2B6 genetic data to make changes to the standard prescribing for methadone. Existing clinical guidelines for ECG monitoring during methadone treatment should be followed. This is the PharmGKB methadone pathway. A link to the pathway is given in the description below this video. Methadone consists of two isomers, R-methadone and S-methadone. Although both isomers can be metabolized by CYP2B6, S-methadone tends to be preferentially metabolized by CYP2B6 in liver cells. When CYP2B6 function is decreased, plasma concentrations of S-methadone are increased and clearance of S-methadone is decreased. This results in an increased exposure to S-methadone. Exposure to the R-methadone isomer is not significantly affected by variation in CYP2B6. Despite these documented effects of CYP2B6 variants on S-methadone pharmacokinetics, there is only limited evidence that changes in S-methadone exposure lead to clinically significant changes in methadone dose, outcomes, or side effects. CPIC assigns a no recommendation to a gene-drug pair when there is insufficient evidence, confidence, or agreement to provide a recommendation to guide clinical practice at the time of publication. Due to an absence of published data, the authors assigned a no recommendation for genotype-guided prescribing of methadone in CYP2B6 ultra-rapid metabolizers. Based on the evidence which was available when preparing the guideline, the following CYP2B6 genotype groups are advised to follow standard dosing, titration, and monitoring of methadone: rapid metabolizer, normal metabolizer, intermediate metabolizer, and poor metabolizer. The guideline authors evaluated the evidence connecting CYP2B6 variants with various clinical outcomes. Their conclusions are summarized on this slide. There is some evidence that the decreased function CYP2B6*6 allele is associated with lower methadone dose requirements in patients being treated for opioid use disorder. However, this finding has not been replicated by the majority of studies which looked at CYP2B6 variation and methadone dose. Research has not found a significant effect of CYP2B6 variation on response to methadone in patients being treated for opioid use disorder. A single study has investigated CYP2B6 variation and the risk of QTc prolongation when treated with methadone. It found that the CYP2B6 poor metabolizer phenotype was associated with longer QTc intervals. However, it is not known whether this effect has any clinical importance, and this finding has not been replicated. The CPIC guideline for opioids and CYP2D6, OPRM1, and COMT contains no recommendations for methadone and CYP2D6, methadone and OPRM1, and methadone and COMT. A link to a video summary is given in the description below. This guideline has been annotated on the PharmGKB website. This includes a summary of the no recommendation and excerpts from the guideline. Remember that variation in other genes in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.